There's a lot going on with cybersecurity, and this is really getting serious. If you think about your time before you retired, what was the greatest threat that your health system faced with regard to cybersecurity?
Well, true confessions, we actually did have a breach in 2006. And it was determined by the FBI that it had been a Russian hacker. Fortunately for us, it must have been a Russian hacker in training because they didn't get much. And we were able to determine that we didn't have to go public. They hadn't accessed any sensitive information. And we knew exactly how they got in. So it didn't scare us as much as it might today. But we started a cybersecurity program with the turn of the century, initially based upon HIPAA, and then it started growing over time. I would say that when I left Sharp, it was more a case of planning for something that we didn't ever really think would happen. And the debate was with the caregivers about how quickly their screen was to shut down and things like that, because they hadn't heard of significant breaches and it wasn't real to them yet.
Right.
In the past several years, you bet it's real. And whereas I was kind of viewing it as a necessary evil back then, I'm just super passionate about it today. With some of the opportunities I've had since then, I've seen different security programs, different philosophies of the security leadership, everything from a small shop that is so confident that nothing is ever going to hit them that they just are almost cocky about it. And I just say, well, I hope and pray that you're right, to some organizations that are extremely well organized in their cybersecurity programs, very well disciplined. You see it everything from soup to nuts.
Yeah.
And you bet it's a serious thing today. We were observing last September when University of Vermont Med Center was offline for a month. Well, my former friends at Scripps Health in San Diego are in their 12th day right now. And that's pretty scary. And you got to think about that, just the impact on getting the IT program back in line. How about the patients that are trying to get care?
Right.
And I've seen some comments on Facebook, patients that don't know whether their surgery is really going to happen or not per schedule, and trying to find out how to reach somebody, to an ill patient trying to get their records transferred to another center for some specialized procedures, and how do I get to them? You're pretty well dead in the water without those computers these days.
So how do we get ahead of this as an industry? So if we brought you back as a CIO and seeing what you're seeing now, where they can take you offline for 12 days or 10 days or whatever it is, I mean, how do we get ahead of this?
Well, first of all, I can tell you there are a lot of people smarter than I am, but I really do think you've got to take it seriously. And one of the things we've seen in the financial world is that we've been audited forever. And I would say that, having been through financial audits, they're not that rigorous. I think that organizations need to be ready to subject themselves to an external assessment, whether it's annually or every 2 years. You got to do it. You got to take it seriously. In the first of the year, there was a safe harbor provision in the law for organizations that are using NIST as their guideline. And just from what I've seen, there's one thing to say you're using NIST, to actually rigorously following it and having yourselves evaluated in terms of how rigorous your security program is. You got to take it seriously. I've seen organizations that, and I will say, I was on a board committee of a large health system with a very sophisticated security program, and almost in every quarterly report, the CISO would recite almost every breach involves the compromise of privileged credentials, and multi-factor authentication comes in there. When you hear an organization say, well, the CEO doesn't like to have to use two-factor authentication, so we turned it off for them, that's just the wrong approach. I mean, we have to have teeth in our cybersecurity programs.